Hello, Calaveras County, and the doctor is in. I'm your host today, Mike Taylor, and with me, of course, is Dr. Randy Smart, board-certified internist. Hello, doctor.
Hi, Mike. Thank you for inviting me. It's great to be here today.
You bet. Now, you've got something on your wrist here. What's up with that?
Well, what I thought maybe we could talk about today was certain neurologic problems that can occur in patients' hands. And they're common problems. Many of your viewers, I'm sure, have them. They may or may not know that. And they're pretty easy to recognize and pretty easy to manage at home.
Okay.
The one I had in mind is a disorder called Carpal Tunnel Syndrome.
Oh, sure. It used to be that we thought only secretaries got it, or folks who sat at the keyboard typing all day. Is that the case?
Well, those are risk factors. It's actually a very common disorder. It's reported to occur in 5% or so of the population. Now, that doesn't sound like a lot, but in a county with 40,000 people, the quick math is something like 2,000 people in Calaveras County have carpal tunnel.
That's a lot of people.
That's a big number.
Sure.
Right? I would guess maybe a third of those at the most have ever talked to their doctor about that. They either don't know what it is or just live with it, or but it's very common. The secretary type work environment is part of that, but there's other things that contribute to that. And I thought maybe we could talk about those too.
Sure. Well, right before we started filming, I told you that as a meat cutter in an earlier life, that is when I was diagnosed with carpal tunnel syndrome. It really surprised me. And when the neurologist was doing the exam, he said, yeah, all the patients I have with carpal tunnel right now are meat cutters. So is there something about that and, locking the muscles and
Sure.
those kinds of motions that contribute to this?
So let's think about this for a minute. The way your neurologic system is designed is you have your central computer, brain, and from that comes the spinal cord, up and down your back, and out that spinal cord comes all these nerves. So brain, spinal cord, a bunch of these nerves come out into this area. This is a very complex area. They go all the way down the arm, and they go into the hand. And so if you think about what could go wrong between here and here, there's actually many, many things.
Sure.
You could start here and say, well, could a stroke cause problems with my hand? Absolutely. Could a neck problem cause problems with my hand? Absolutely. Could shoulder problems do it? And as you go down, one of the more common problems is called nerve entrapment.
Okay. And
nerve entrapment can occur anywhere where there's a narrowing or a bending or a place where nerves can get kinked. And it turns out in our hands, there is a very small little tunnel.
Right in there, isn't it?
Right in there. It's called the carpal tunnel. And through that tunnel goes some very important nerves and some other things. And those nerves don't have much room to move. And the nerve we're going to talk about today goes to the thumb, the second, third, and only half of the fourth finger.
Oh, okay.
So sort of 3.5 fingers. And so the carpal tunnel is one of the places these nerves can be trapped or pressed or squeezed, and that is sort of the cause of carpal tunnel syndrome.
Okay.
So to get back to your question, can this happen with meat cutters or repetitive motion? Anything that provokes flexion of the hand.
Okay.
And we can talk about what does that. Or particularly repetitive motion can be a trigger for carpal tunnel syndrome.
There's a lot of talk, and I want to say maybe a decade ago it sort of started, and with ergonomics and setting up your desk, and now there are even desks where you can stand up at your desk and helps your back and whatnot. But the what I learned in my day job now, I'm sitting at a desk and typing. And you have to be really careful about kind of the angle that your hand and arm are coming at that keyboard where your hands are. Can you talk about that a little bit?
Absolutely. You know, I first encountered that scenario actually when I was an Air Force doctor. And we would have many people using computers, ergonomics, and about half of them had neck problems because of this.
You lock yourself in that
Right.
computer position.
But all of them had carpal tunnel syndrome.
Oh, my gosh.
And so we had an occupational therapy service, and we have that also in Calaveras County. There are sources for this. But the occupational therapist would actually come to the work environment, look at the chair, look at the keyboard, look at the desk, look at the neck, make all kinds of adjustments, and with that only, there was a good resolution, good outcome, problem solved.
Oh, great.
Now, today, occupational therapists are fully capable of doing that. We have them in the county, as I said. And so when in my practice, when we see people where we think their carpal tunnel has an occupational component, we ask occupational therapy to see them, to adjust their ergonomics, and to do what they can in the workplace.
Okay.
And that can be very helpful.
Oh, I bet. Now, continuing on with the computer thing, are we seeing more carpal tunnel in younger people because they're sitting around playing games and you know, everyone is sort of locked in this position? Is that becoming a factor now?
You know, I think the answer is yes, and that's purely anecdotal. It's purely my experience. But in the last 10 years, I think we've seen much more carpal tunnel and much more neck problems.
Okay.
And I think it is related to exactly what you're suggesting, the use of a computer, the use of a desk. I don't know that that's been increasing in the last 2 years, and I certainly don't know anything about our pediatric patients. But within the last 10, much, much more.
What do people feel when they're getting what we're calling carpal tunnel syndrome? What are they going to notice that they might not realize is carpal tunnel syndrome?
You know, I was really hoping you would ask me that. So those that have carpal tunnel, what they will normally notice is that they have numbness in the first 3.5 fingers.
Oh, okay.
Now, they can have pain. There can be pain associated with this. Classically, it's 3.5 fingers, the inside of the fourth. But it can include the whole hand. There are cases that include the whole hand, and there are cases where the pain goes up into the forearm. But typically, it's the first 3.5. Now, the classic scenario is the patient who wakes up at night.
Oh.
So this is what the patient will tell us. Doc, I go to sleep, and sometime in the middle of the night I wake up and my hands are numb, and they tingle, and I don't like it.
Gosh.
And I have to shake them.
Almost like they've gone to sleep, as we would say.
Exactly. And so then I shake them, and it gets better, and I move around, and I go back to sleep, and that can happen a couple times a night, but it keeps coming back. It happens every night. So do I have a circulation problem?
Yeah.
And just that history alone is almost diagnostic for carpal tunnel.
Okay.
And so the reason for that is what we do when we sleep at night is we kind of flex, whether we're aware of it or not. When we go to sleep, we gradually start flexing, and I think it's probably some reflexes, some spinal reflexes that are protective.
Okay.
Because the more curled up we are, the less vulnerable
The safer we are.
Right? The less the other caveman can hurt you.
Yeah. Or the
Right?
saber-toothed tiger isn't going to
Exactly.
jump in and get your belly.
Exactly. So we flex at night, and we don't know.
Okay.
So when we do that flexing, we crimp our carpal tunnels.
Oh, yes. Okay.
And so then it becomes numb and tingly, and then finally you wake up and you go, man, what is wrong with my hands?
Yeah. Was I laying on them, or
Or do I have cancer, or what's wrong? And so it's a very common nighttime nocturnal symptom. Now, interestingly, the majority of carpal tunnel is bilateral. Now, it's not, so it's both hands. Now, it's not bilateral symmetric. It's not like they're both exactly the same, although they can be. But typically, one hand is worse than the other. But if you really take a thorough history, you'll find out that both hands are involved, because both hands flex.
I was going to say,
They just do.
You're usually not asymmetrical when you're sleeping and your body is doing its own thing. So
that's the very common history. Both hands, 3 fingers, they get numb, they kind of hurt, I don't like it, I shake them, it gets better. I've been doing this for about a year, I'm really tired of it. But certainly it can be at other times. It can be at the work environment, at the computer desk, as you say.
Yeah.
We have a fairly robust building industry in Calaveras, and the guys with the hammers and the saws.
I was going to say, will that contribute to it too?
Absolutely.
Okay.
Absolutely.
And again, it's that repetitive motion. Is that kind of the enemy of the carpal tunnel?
It seems to be.
Sounds like it. Because when I had the problem as a meat cutter, it felt like it was more on my right hand, but the doctor did do a lot of exam on the left arm, because he said, you're locking that hand to hold the meat that you're cutting on.
Absolutely.
And I hadn't really noticed it, but what it was for me is exactly as you said. These fingers would go numb middle of the day, and I actually felt it I felt the line is what I felt, and I thought, okay, this is, I thought, nervous system, because it felt like a string was kind of pulling in there.
Tingly kind of feeling, right?
Yeah, kind of uneasy, kind of that weird, something is pulling in there that shouldn't be. So what do we do once we diagnose it?
Well, so it can come in different forms of severity. Most carpal tunnel syndrome is what you would think of as mild. The patient will have the tingling, they'll have the kind of nocturnal or workplace stuff, but they don't lose function, at least early on in the process, and most never do. But if the carpal tunnel continues, you can have loss of function in those fingers and in your hand.
Okay.
And in particular, you'll see this muscle here in front of my thumb.
Kind of the big meaty part of the thumb down there in the bottom?
That's a really important muscle. And if your carpal tunnel becomes advanced enough, that muscle goes away.
Oh.
So you will see people who have a hollow spot where this muscle should be.
Really?
That's a more severe form of carpal tunnel.
Sure.
Probably the best advice is, if you have carpal tunnel, you probably ought to talk to your doctor or primary care provider about it. Not everybody has insurance, not everybody can afford it, not everybody can break away from work. So if it's pretty classic, you could probably do some things at home to improve it without the doctor's appointment. And this would be an example of one of the things you could do. I don't actually have carpal tunnel syndrome, but one of the things we recommend is what's called nocturnal wrist bracing. So nighttime wrist braces. And what we do is we usually take the worst hand, and let's say it's my right hand, and we say, look, every night when you go to bed, put on a wrist brace.
That makes sense.
Go to the drugstore, the pharmacy, buy a wrist brace every night. And so what you'll see is I can't flex my hand. And initially the patients go, well, I'm not going to do that, And you go, it's up to you.
Okay, keep waking up at night.
It's up to you. And then they will come back a month later and say, this works. This is great. I like it. And so that, I think what happens, Mike, is that ultimately becomes not something they wear every night, but if it's bothering them more, they wear it for a while. And a carpal tunnel will do this. It'll kind of come and go.
Oh, okay.
So you can have a bad month or maybe even a bad year, and then you can have a good month or a good year or a good week. And we don't know exactly why it comes and goes, but that tends to be the clinical course. And so patients will use these when they need them. Now, yesterday, I went to the local pharmacy and I bought this so I could see what it was like to wear it, and I could show you what it would look like and show the viewers. But you can buy these, if you buy them locally, which is supporting local business, you can buy them for about $25. Mm-hmm. If you get on Amazon, you can buy them for about $10.
Sure.
But it's not a big expense.
Is there certain, or how do I word this? Are there certain parts to the piece that should, you need to make sure are there, or do you just get a wrist brace and that's going to take care of what you need?
The most important thing is there is a right and a left. Mm-hmm. And they actually come in small, medium, or large.
Okay.
Most people can figure that out. But there's a right and a left, and obviously you want to get the right for the right hand. Mm-hmm. But it's very straightforward. I mean, this comes off as simple as that.
Oh, wow. So it's almost like putting on a sock.
So at night when you go to bed, you tighten it up.
Yep.
You put on the Velcro, you're done.
You're done. Okay.
That fast. I think that was about 7 seconds.
If that,
maybe
that's right. Maybe that if you had to take it out of the package.
and the goal is simply that you can't flex a lot while you sleep. Mm-hmm. But it's really as simple as that.
I'll be darned. Is there any dietary component to this? I mean, is there something we should be eating that kind of helps lubricate the carpal tunnel, or?
Well, I wish I knew the answer to that. What we know is that patients that are heavier, overweight patients, tend to have more of this.
Oh, okay.
We don't know if weight loss makes that go away.
I see.
It might, it might not. Mm-hmm. We also know that we see much more of it in our diabetics.
Oh.
The diabetics have more of it, even in the absence of diabetic nerve damage. Mm-hmm. They just have more carpal tunnel.
Okay.
We're pretty sure that good diabetic control will improve their carpal tunnel. Mm-hmm. So those are the kinds of dietary recommendations I would give to patients. If they were overweight, I would say, weight loss may really help this. Let's work on that.
Among other things, it's going to help.
It helps everything. It helps everything.
Never mind the heart. Let's fix the carpal tunnel.
But also with a diabetic, if their control is not optimal, we would push for better control, believing this would probably get better.
Sure. I'm a type 1 diabetic myself, and the doctor was concerned about that, and he was very concerned about my feet, which I've always been aware of them. Since I was first diagnosed at age 10, I knew keep track of your feet. If they start, you start feeling any numb spots, we're having problems. And I have not had any signs of neuropathy. I've been very fortunate in that way.
That's great.
That's not to say that my control is all that incredible, but I've been very fortunate with the neuropathy part. But what I was interested in with the carpal tunnel is it just seems like one of those things that almost everyone could have. Because we all do things it would seem, just shifting your manual transmission car. It's a repetitive motion. Your arm is always kind of locked in a position. Is there, aside from the brace, is there something else that you do to help carpal tunnel? Do you, keep your hands flat on the table kind of thing so that they're not flexing, or is the brace the best way to go for that?
That is an excellent question. So carpal tunnel can advance to loss of function or more disabling or, potentially losing your job, interfering with recreation or family activities. And wrist bracing, although it's among the first things you do, it's not always as effective as we want it to be. And so in those scenarios, the problem can continue and even progress. So there are things, exactly. And so one of the things that can be done is testing that really tells us for sure that's a carpal tunnel problem.
Oh, okay.
And that's called nerve conduction testing. Mm-hmm. Patients don't really like it because we stick needles into the nerves and we measure things.
I was fascinated by it, but it was a little weird.
Much better to watch than to go through.
Yes.
But that nerve conduction testing is available. We order it. And in particular, we order it to make sure we've got the right diagnosis. but also in preparation for more treatment. And the more treatment actually is surgical treatment.
Okay.
So our orthopedic colleagues are able, in cases, to release the pressure on the carpal tunnel.
Okay.
So they're able to take a patient into the operating room, and honestly, Mike, this is a 15-minute operation.
Really? It's that quick?
I believe this is one of the shortest operations there are. And they quickly release the pressure on the carpal tunnel. They sew it back up. The recovery is a relatively quick recovery. And the results are very, as long as the diagnosis was made correctly, the results are very good.
So is it just a matter of them sort of, in layman's terms, kind of increasing the size of the pipe that all those nerves are going through?
Exactly.
Is that what okay.
That's exactly the way you think of it.
Okay.
They just open that up.
So they make a slit and then it'll heal itself, ideally larger than it was? Okay.
Yeah. There is a piece of connective tissue that goes across that, and they basically release that.
Oh, I see.
So there's no longer connective tissue, and there's not a detrimental aspect to that I'm aware of.
Okay.
The incision looks like a Z, like a Zorro kind of thing.
Interesting.
But
it can be fun at parties.
Sure. Great topic of conversation. It's about 2 inches long. It's very effective. That surgery is available in Calaveras County and our sister counties, and simply takes a referral. So there are actually many patients that have carpal tunnel surgery. When I'm in the hospital, we're looking at what other people are doing, and we do quite a bit of that.
Okay. So you just 5 or 6 patients in 2 hours, and
they might. They might. I don't do the surgery, but we have very good surgeons, and that might be exactly what happens.
So if someone is waking up in the middle of the night with their hands feeling funny, they can try the brace. That doesn't work. Pretty much that's time to go see the doctor?
Yes. So when should you see the doctor? When you're not sure about what's wrong. And, the issue is going to be another nerve problem or related to another problem I have. When you're not sure what's wrong, it's always good to go see the doctor, provider, and just say, is this carpal tunnel or not? If there are any other neurologic symptoms, have to see the doctor.
Yeah.
Carpal tunnel is one nerve, both hands, but it's not any other nerves in your body. So if there's any other nerves involved, medications sometimes can cause neuropathies. Diabetes can cause neuropathies. So yeah, certainly if there's any loss of function, you would want to talk to the doctor.
Oh, sure.
And I think most people would do that. But those are sort of the things that would be more disconcerting to me.
Do we see much carpal tunnel, say, in folks who play a lot of tennis or, those kinds of, or softball players and that kind of stuff?
It's more, not to my knowledge.
Okay.
It's more like you say, the people that are really using their wrists at computers, meat cutting, lots of flexion. It's more of that group of patients.
Well, it strikes me, and I always kind of mentally imagine myself sitting there at the keyboard, and you get that sort of whole body locked sort of thing. And that's when you mentioned problems in the neck. I thought, boy, you just nailed about 50% of my crummy days at the office.
Exactly.
Because and I think that's what it is. We just sort of, okay, now our system is set and we're not going to move it for 2 hours, and then we go on a break or we go to lunch or something, and
and the next day everything hurts.
And the next day everything feels like you were in a bus crash. I mean,
Right.
It's just something else. So are there? It sounds like there aren't, but are there any kind of like exercises? Because it doesn't. And this is probably my layman brain getting in the way, but it doesn't sound like something you want to stretch or flex, obviously, because the flexing is what's causing the problem. So is there anything like that folks can do?
Not really to my knowledge.
Okay.
Now, we have some great physical therapists in the county, and they may have maybe some new information maybe I'm not aware of. But to my knowledge, there really isn't a stretch or an exercise or an activity that will improve it.
Yeah.
There are those that will make it worse.
I can imagine. Yeah,
Right.
yeah, sitting at the table doing this.
So maybe you could say not doing those
Yeah.
would be what you could do, but not really, not like in a proactive sense.
Yeah, that's
Not really.
what I was kind of thinking, and that's why I asked the dietary thing too. That it seems like everything we put in our bodies goes somewhere and causes a problem or fixes something.
Exactly.
It's very interesting in that whole, and again, back to the computer, garbage in, garbage out. If you're not treating your system well, it's not going to work well for you. But now, have you worn the brace all day today?
Most of today, yes,
Okay.
I did.
What I was going to ask is, did it get in the way? Was it a hassle to wear?
So I wore this brace all day because I knew I would be on the show, but I also try hard to understand what we ask patients to do. And
Good for you. Congratulations and thank you, doctor.
So I've actually, for our diabetics, I've done finger sticks on myself for an entire week. So I understood what I was asking him to do.
Yeah, sides of the fingers, not the pad.
Right. And so I wore the brace all day, and it's actually not that big a deal.
It doesn't look like it.
It's
no.
very doable. There isn't anything I did today that I thought was either hard to do or was a problem. So in the future, when I ask, most of the patients that wear these braces will wear them at night only. And I didn't do that last night. Maybe I should have. But sometimes we'll have them wear them during the day if their symptoms are particularly bothersome.
I was going to say if it's particularly serious or they're getting that numbness during the day.
Exactly. And so now when I make that recommendation, be forewarned, I know what I'm asking them to do, and it's not that big a deal.
And it's not that hard to comply with. And patient compliance is one of your biggest bugaboos, I would imagine.
Right. So it's very doable. It's very accessible. Our pharmacies and drugstores have these or online. You just need to get the right or the left. Some of them will even be labeled as for carpal tunnel.
Oh, okay.
But it's a pretty intuitive idea. You just want something that'll prevent flexing.
Yeah.
There are splints that have a thumb immobilizer. They're called thumb spica splints. That's not necessary. That's for a different problem.
Yeah, you haven't broken your arm or anything like that.
And you want to be able to use your thumb. Your thumb is super important.
And you've got pretty good mobility there. I could see wearing that during the day and it not really getting in the way of much of what you've got to do.
Not that big a deal.
Unless you're doing surgery, obviously, but
not that big a deal. The other thing I thought maybe if we have time I could bring your attention to is there is a disorder called Raynaud's phenomenon where your fingers turn blue and tingle.
Oh, goodness.
That is a different problem. That's not carpal tunnel syndrome. So if you're one of those that put fingers in a refrigerator or cold water or outside and they turn blue and tingle, that's called Raynaud's. We could talk about that someday on the show. I'd love to do that. But that's not carpal tunnel. That's a different problem.
Is that a go to the doctor, do not pass go, do not... that sounds pretty... Oh, okay. Then we'll have to catch that on the next one because we have run out of time, Dr. Smart.
I'd be happy to do that, Mike.
All right. Well, Calaveras County, stay healthy. Now you know how to keep your wrists healthy. So if you're curling them up at night, fix it and you'll feel better. Thanks for joining us on The Doctor Is In. I'm Mike Taylor for Dr. Randy Smart. Thanks. We'll see you next time.